Okay, she's having a little discomfort here in this region. It's currently aggravated. It is a bit chronic. It's a bit of an ongoing pattern. And if we just assess, just even visually, we can see she is right-handed, and we can see a little more definition on this side, the scapular line here. And we can almost see, you can almost see the swelling here. And again, remember, she's right-handed. Now, if I come onto the tissue, just the skin level, and just get a sense of the skin mobility, skin and the underlying connective tissues mobility. And look at this. This really gives, and we can get, it conforms readily to the pressure. Here, up high it does, but as we come down, look at the difference inside to side. This is it's a much larger, it wants to hold together, a much bigger piece of skin, or a much bigger group of skin wants to hold together because there's more swelling, there's more fluid in the area. The lighting in here is good for this, but it's not ideal maybe to see that even the blood vessels are a little swollen there, and you can see that. So that's where we're starting with that. Then I did want to point out that as a general landmark, the bottom of the scapula, as we come across, it's generally right around C7. If you drop your head forward, please. Usually the first vertebrae that you feel as you come down this line is usually T1. And you usually, drop again, please. And usually C7 slides a bit forward on T1 inflection. Would you come back, please? Thank you. Here, if I come under the rhomboid, so here was the skin. Now I'm going to come under that first level of muscle. And there's a tension here for sure, a resistance. My thumb's along the angle of the rhomboid there, see? But here, again, it's more defined. You may not see it, but I can pick up that muscle very easily. Here, it's more stuck together. It's more of a group. They're less defined. And again, that's because of the swelling. So one useful, if I were just on this rhomboid, let me pause that for a moment. Let's come still up to the trap, and you can see again the angle, and you can see how this is kind of more rounded in comparison to here. Here, this is a little more of a line, and here you can see this rounded shape of the swelling and the tension in that. In this part of the trap. So you can come along the rhomboid and just lift that up. That's a very useful kind of movement. You can also add to that by holding the rhomboid. See, I'm pinning the rhomboid and moving the arm. You okay with that?
Yeah, it's nice and tender.
Yeah, it's kind of going right for a pretty strong maneuver right away, but it is very effective. It's a myofascial movement, and it does affect the position and the relationship of the muscle to its neighbors. Here we go, coming up through here. There we go. You okay?
Yeah, feels good.
It's getting a little red. Okay. So even with that, now the trap has actually softened a bit. What's interesting is that if you're familiar with the anatomy here, that trapezius rolls over here. And so it's turning, the muscle fibers are actually turning. They turn as they attach onto the clavicle here. UC joint. So I usually don't like to get into a real tug of war with the trapezius. I'd rather use the mechanics to get it to relax. Often I'll do that at the cranial base, and the trapezius will attach all the way up here. So here's the base of the skull, the occiput. We come up a little bit higher, about here. That's actually where the trapezius attaches. So I like to work the top of the trap from there. This gets very tight. People like to have it worked, but to me it's often not as fruitful. But often I will treat the attachment here. And one way to do that, I'll do it on this side because it'll be easier to see with the camera, maybe from here. So that muscle's coming down and attaching here, turning. There we go. And so we can bring that posterior and just bring those fibers. You're not truly untwisting them. They're supposed to be twisting. But by giving a little counter rotation, we can really get that to relax. And that's actually softened up quite a bit just with that. I'm going to try it on this side. So this time I'm doing something like this, because this is the affected side. So I'm kind of pulling the two ends. And because we're at the neuromuscular junction, we got a lot of the proprioceptors here. Golgi tendon organs, the stretch reflex. So if I can stretch it, move it, add a little bit of pulsation, Golgi tendon organs, rate of change. There we go.
It's very warm.
It got very warm. So you can see the color here starting to change the blood flow. And you're seeing that just like that increased metabolism is the heat, or the heat reflects the increased metabolism. So I'm going to come back. There's still a little bit along this top of the scapula. I'm going to do that. We already did it. We can